Hey guys, I hope you're having a fabulous day so far. Welcome to my channel. My name is Nyla. I'm a public health educator that is here to share knowledge and tips with you on ways to access care that you need while saving money in the process. There is a lot of information out there about people who have lost their jobs and they have lost their health insurance during this pandemic. And now people are not able to afford the healthcare services that they need. But I'm not really hearing many people mentioning what are their options when they need healthcare and they can't afford it. So I'm here to talk to you about what your options are when you cannot afford the healthcare services that you need. I'll give you a little backstory about myself. So when I was in grad school, I didn't have health insurance. I was working at a job that did not provide any healthcare benefits for me. Actually, I was working in a hospital. How about that? In the emergency room. In that department. So I was working in the emergency room while I was in grad school. I did not have health benefits. I can check my blood pressure and my oxygen level for free. I could do like the basic stuff, but I couldn't actually get seen, as a patient without paying an astronomical bill. So I was working in a job and I needed healthcare services. And I'm like, where can I go? Too much money for Medicaid. I was not even eligible for Medicaid at all. And this was outside of the enrollment period for the Affordable Care Act. So I was on a mission. I'm trying to find health services that was not going to hurt my pocket. Where would you go when you really need to go to a doctor to go see something that's going on with you or your family? And you don't think that you have any options, and you think that the only place you can go to is the ER, and then be billed that astronomical bill, because you think that's your only option. Well, I'm here to share with you what your options are when you are in that particular situation, because once upon a time, I was in that situation. Federally qualified health centers. I hope you guys have heard about this. They are also known as FQHCs. They're health centers where patients can pay on a sliding scale based on their income. But they also will not deny services for people who cannot afford the services at all. So if you're going to an FQHC and you know that there's a sliding scale and you can't afford the minimum payment, they're not going to say, nope, you can't come. So that's one option, the Federal Qualified Health Center. According to the National Association of Community Health Centers, 29 million people, which is about 8% of the U.S. population, access care at one of these healthcare facilities. And there are about 12,000 sites throughout the country. So the question of the day is, where can you access an FQHC? Where can you find one in your area? Great question. So if you go to findahealthcenter.hrsa.gov, and go to a location box. I live in Chicago, so I'm going to put Chicago in the location. I'm going to change the filters. I'll just change it to 20 miles actually to have a larger range. And scroll down. And then you'll be able to see all the different federal qualified health centers that are in the Chicago area. You can click on one of them. I'll just click on this. And then it will tell you where it's located, the distance where you are, and it talks about COVID testing and whatnot. So that is where you can find a federal qualified health center that's in your area. But unfortunately, there are still millions of people who live in America who cannot even afford this sliding scale. So what are their options? They either don't live near an FQHC, they need services that is not provided by an FQHC, or they don't even know that you can even access an FQHC. So what's your next option if you fall into those categories? Good question. Have you heard of a free and charitable clinic? If you haven't, let's talk more about what is a free and charitable clinic and how you can access one. Well, according to the National Association of Free and Charitable Clinics, the acronym is NAFC, they are safety net healthcare organizations that utilize a volunteer staff model to provide a range of medical, dental, pharmacy, vision, and or behavioral health services to economically disadvantaged individuals who are predominantly uninsured or underinsured, or who experience financial, geographic, linguistic, or cultural barriers accessing medical services. Where can you access a free clinic? Where can you go? That's the next question. So to find a free clinic, you would go to the National Association of Free and Charitable Clinics. This is the website, nafcclinics.org. We click on Find a Clinic. I'm already here. Here's Find a Clinic. And I'm in Chicago. I already have it listed. Has 50 miles from in the Chicago area. Here's the map. And here is your list of all the free clinics in the area. This also mentions the website that I had mentioned earlier, how to find a FQHC, where it says that you can go to findahealthcenter.hrsa.gov when you're looking for a community health center. Nicole Lamoureux, I think that's how you pronounce her name. I'm not sure if you pronounce her name, if it's Lamoureux. Nicole, if you ever see this, I apologize in advance if I have butchered your last name. But she is the president and CEO of the National Association of Free Clinics, and she refers to free clinics as America's best kept healthcare secret. Why would a free clinic be a healthcare secret? Probably because there are so many people living in this country who do not even know that free clinics exist. There's so many people who live in this country who don't know free clinics exist. They don't know free clinics exist. They don't know that federal qualified health centers exist. So they think that the only place they can go to get healthcare services is a hospital. And if these people who do not have health insurance, or they can't really afford any other type of healthcare benefits, they go to the hospital. They go to the emergency room. When I used to work in the emergency room, I see so many people who would come in who did not have health insurance. And I would ask them, why did you come to the ER and you didn't go to one of these other clinics that you passed to come here? And their answer will always be, I did not know they existed. And that is really sad in this country, that there are people out there who are suffering in silence. It's not advertised. It's not advertised that there are federal qualified health centers out there. It's not advertised that there are free clinics out there. It's just people who just think that they have no place to go, and they go to the extremely expensive emergency room for non-emergent issues. When you can go to a clinic, be seen quicker than going to the ER, and not have to deal with the frustration of that bill that you're going to get, because you'll be thinking about, how am I going to pay this bill? Because you don't have health insurance, or you can't afford health insurance, or the insurance that you do have is not accepted in certain places. Free clinics play a critical role in the healthcare delivery system in this country. Not everyone who goes to a free clinic or an FQHC, which is, I don't know why I cannot say those 4 letters, in FQHC, is unemployed. In fact, majority of the people who access these healthcare facilities come from working households. And unfortunately, not all companies provide health benefits for their employees, so they have to find other options of where they can go to get care. And that's why there are people who know about FQHC or who know about free clinics access those healthcare facilities. And that is what I want to share with you. If you do not know about FQHC, you didn't know about their free clinics, I so hope that you go to those websites, because the misconception with the passage of the Affordable Care Act is that everybody is insured or everyone is eligible for Medicaid, and that is so far from the truth. It is so not true. If that was true, then we wouldn't be in this situation to begin with. We wouldn't be thinking about we're trying to get health care for people. Some people can't afford it, or, we wouldn't be having this issue at all, because everyone will be insured. Unfortunately, we don't have that, and that is why people keep talking about this. The America needs to have universal health care, which I agree with. So I want to end this with, if you are currently going through some type of financial hardship and you are looking to get healthcare services, please check out the websites that I just provided. I also want to say that if you are in this current situation, just know that you are not alone. There are so many people out there who are hurting. There are a lot of people out there who are in pain, and don't be ashamed. Don't feel embarrassed. Just also know that with hardship comes ease. So thank you so much. If you have come to the end of my video, thank you so much for tuning in to my channel. My name is Nyla. I'm a public health educator where I will continue to share tips and knowledge with you on ways to access the care that you need while saving money in the process. Thank you again. If you like this video, please give me a thumbs up. Please press the subscribe button. I will continue to post a lot of videos once, twice a week. And share and press the notifications. Thank you again. Bye.